So thanks so much. Our next speaker is Dr. Judy Tan. Judy is an assistant professor of medicine at CAPS, Division of Prevention Science. She's a behavioral and prevention scientist trained in social and health psychology, and uses quantitative research methods as well as intervention development to elucidate multi-level causal processes of health and to develop novel interventions to reduce health disparities, particularly those among gender and sexual minority people of color. So Dr. Tan is the PI of an R01 funded by NIMH to develop mHealth capacities that target that target and leverage dyadic factors for enhancing HIV care engagement among Black, gay, and bisexual men. She's also the PI of the National Institute of Aging R21 to develop a choir intervention to promote psychosocial well-being among older people living with HIV. And her research interests include food insecurity, HIV and aging, smoking cessation, and dietary acculturation and cancer risk. So, Judy, thanks for joining us today.
Thanks so much, Sherry, and thank you, Rochelle. And I want to parrot what Padia just said. It's an honor to be on the same panel with Ida, Courtney, and Padia. Ida was obviously a seminal figure in my training in my K award leading into the R01 that I will be talking about today. So I want to quickly go. So I want to talk primarily about the two studies that Sherry just mentioned. But specifically about how we've had to adapt our recruitment strategies and what we've seen as a result of this adaptation. And then with the choir intervention, how we've had to start thinking about our research question differently. So the R01 that Sherry mentioned is a mobile app called Let's Sync to promote HIV care engagement among Black men and couples. So we were funded in 2019, and we are currently recruiting. We're in AIM 1. Basically, the timeline is doing interviews that were pre-epidemic, pre-pandemic, was supposed to be in person. So AIM 1 interview was supposed to be, so basically, just to give you an idea, so the trial is supposed to be a pilot test of the app with 80 couples, but with some of the visits being remote and some of the visits being in person. So currently we are still in phase 1, or we're doing AIM 1 research, in which we're trying to really understand, conducting via interviews, really trying to understand how resiliency among African-American men in couples, kind of a stigmatized relationship in society, especially in current times, I think, how that may be leveraged in care engagement. So the inclusion criteria for 24 couples, a total of 48 individuals, is that at least one person in each couple is a Black cisgender man living with HIV. And the proposed recruitment approach it's very similar to how we typically do things, right? In-person outreach, print and online advertisements, and using different resources that we have available, including CTSI, mailing letters to patients found eligible in our EMR, as well as our community engagement efforts that Barbara and John run. So the recruitment for Let's Sync began late February 2020, and then of course we had to switch gears and really start to think about how we might want to engage folks especially given that this is, you know, as Courtney has mentioned earlier, that there is this literacy, this access to literacy issue. From my own, you know, qualitative research, I found that the interest is always there. And then in the Bay Area, there are, the access is slightly better, if not a lot better than most of the folks around the country, in terms of looking at just African American communities. But because of the pandemic, we really wanted to start to open up the eligibility criteria, because whereas before we wanted to bring folks in to do in-person interviews, we started to consider really expanding our geographic engagement to areas outside of the Bay Area. So if we look at I charged my team to start to identify various community-based organizations, or CBOs, clinics, aid service organizations, various organizations around the country, leveraging email listservs and Facebook and anything that we can find online to start spreading the word about this one-time interview that we were doing on Zoom. And then one of the things that we did not put a lot of stock in to thinking about was leveraging dating apps, gay dating sites to engage the sample. But we decided that because we were quite desperate, you know, it was very apparent and earlier on that it was very difficult to recruit couples, and not just individuals, but couples. So even if one person is eligible for the study, if one of the partners, you know, refuses or is ineligible, otherwise ineligible, you know, we're dead in the water. I mean, that, you know, so we really, you know, becomes really difficult, as people in the audience can realize, who do dyadic research can appreciate. It's very difficult to get couples into the research. So we decided to really expand all possibilities, and then to engage folks on dating apps. And lo and behold, what we did find, the strategy that we found the most fruitful actually was so far is via dating apps. So we've had success in through painstaking engagement strategies, and we're currently working on publishing that paper, writing up the results of that paper, so that we can describe the you know, the novel ways in which we're engaging folks on dating apps to recruit couples. So we've been able to also leverage other methods that are pretty typical in our research. And as of yesterday, we were able to include in our sample for AIM-1 21 couples, a total N of 42, which I think is just a tremendous, tremendous testament to the hard work of my team. So to give you an idea of where participants are located, we have, of course, folks here in the Bay Area, but we were, as a result of expanding our geographic criteria, we're able to include folks from other regions, including couples who do not live together and actually live across the country from each other. Now I want to switch gears to talk a little bit about something that I am less sure about, and I'm still currently grappling with, which is my choir intervention, a group singing intervention for older people living with HIV, the United Voices Project. We all can appreciate that there's still quite a lot of stigma, especially experienced by older folks living with HIV. And as a social psychologist, I know about this large body of literature supporting the premise that fostering group identity and pride in a group comprises a social cure for psychosocial impacts of stigma. These impacts may include loneliness and social isolation. And for older folks, experiencing pride in part of a group of similar others and feeling personal control or gaining personal control may buffer against these impacts. So one of the objective of this research, the R21, is to leverage singing and singing in a group as a intervention strategy, which was quite novel at the time. So we were funded earlier this year in January, and then of course pandemic hit. We obviously could not bring folks together. So one of the things that we're now trying to grapple with is, okay, so if we can't bring folks to sing together, what can we do, and what are the mechanisms of action that alternative methods can still actualize? So the proposed mechanisms of action include engaging in regular social activities. So this is kind of the schema that I proposed, illustrating how singing in a group, how United Voices as an intervention can buffer against the impact of HIV stigma to mitigate its effects on psychosocial well-being. But I just want to very, very, very quickly show you that one of the ideas that we're currently contemplating is doing a virtual choir. And there are many, 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 including folks on our staff who are in choirs, many examples of virtual choirs, such as this one. So in the interest of time, I won't continue, but I just wanted to give you a sense of the creativity from the community in response to the pandemic, that folks still want to sing and still want to gather. And currently what I'm talking to my project officer about is how are the proposed mechanisms of action going to still be enacted, to be activated in a virtual choir setting. So these are uncharted waters. Obviously, everything that we do will be, unprecedented. I guess one of my messages today is to really reiterate that, I'm really struggling to figure things out. And if anything, I just want to leave folks with the idea that that there's a first time for everything, and that creativity is key here. With that, I want to thank my team, Cindy, Robert, and Javon, and special thanks for DuoPact and referring participants to us. Thank you.
Thanks so much, Judy. What an interesting thing to be studying social isolation right now, even though it started out as an HIV project. Really interesting timing.